All these medical appointments really are a reflection of where we are as a healthcare system and understanding pain as well. I think we have a medical training that tends to really hyper specialize often, where these patients are seeing immunologists, endocrinologists, rheumatologists, neurologists, neurosurgeons, pain physicians, you name it. I'm probably missing some ologists, but there's many ologists. And the big issue with this is it becomes like a forest problem, which what we know pain is. It's a much more multi-system psychosocial, biopsychosocial issue. It doesn't hang out in just our physiology, although our physiology is massively affected by our psychology and the lives that we're living around our pain and the distress that it's put us under. But when we have a bunch of people who are looking at specific trees in a forest problem, so we have your immunologist looking at an immunologist tree, we have an endocrinologist looking at an endocrine tree, which again aren't necessarily bad, but what does that leave a patient with? A absolute laundry list of all these things that are wrong with them that I would argue, and if we look at what we know about pain, that it's likely one big emergence of the massive distress and life-altering problems that pain has put this person under, emerging in different trees in the forest. So what do we do in healthcare? Nobody tells them the story of the forest and how these things all relate to each other and how pain is much more than just messages from your tissue, though they're important and definitely can be part of the problem, of course. It's much more than that. When those messages hit the central nervous system and brain and are impacted by hormone levels and all these different things that the neuroendocrine immune system and much more systems are impacting, what system does that enter? And it often enters a system where this person has lost a lot and has really had a significant amount of stress, distress, depression, all normal emotions that humans would experience. But when our body is trucked full of those emotions 24/7, 365, it creates an ecosystem that is massively dysregulated for a person.